Hey everyone, happy Wednesday. We'll wait just a few minutes and let y'all hop on with us. If you're joining us today, say hello, let us know where you're watching from. Hey Evelyn, Lori, Melissa, and Wendy. All right, good group. Okay, we are live today with Dr. Tony again. He's back with us, and he is going to be talking about trich and anaplasmosis today. So be sure to get any questions that you might have in the comment section. At the end of this live video, we are going to be giving away a Valley-Event gift card to one lucky viewer. So get your comments in there, or just tell us hi, let us know where you're watching from. And with that, we'll turn it over to Dr. Tony.
Thank you. Hi, folks. Hope everybody's well today. Like she said, we got a couple things to cover. We're going to start off with trichomoniasis, most commonly called trich. Then we'll switch over to anaplasmosis and touch on Vfds and touch on some of the regulations there, and then address any questions you might have. Dustin starts off with a question there. I saw it pop up, and he asks if you can give the anaplasmosis vaccine to pregnant cows. So I'll preface that with a little bit of an explanation. There's only one anaplasmosis vaccine that I'm aware of. It's not FDA approved. It's conditionally licensed, which means it doesn't have full approval status yet. And it's out of Louisiana. University Products LLC, I believe, is the company that makes that. And it's only available through your veterinarian. So with that little explanation, yes, that is safe to give to pregnant cows. Historically, anaplasmosis vaccines have been unsafe for that purpose, but this one has had no adverse effects to the cow or to the fetus or even to the calf after it was born. So yes, you can give that to pregnant cows. Okay, so with that question, we'll probably switch back to trich now. We'll swing back to anaplasmosis near the end. That way we can finish out with VFDs if you guys have any questions on those. But trichomoniasis, it's a venereal disease of cattle, which means that it's spread during breeding. Bulls are the reservoirs, the carriers for this disease. So the organism that causes it lives in the bull's sheath and his preputial folds, and then as he breeds that cow, he infects her. And what happens is that it causes early embryonic death and reproductive loss on the cow. There's no clinical signs on the mature animals that are affected, no clinical signs in the bulls, no clinical signs in the cows. So the only thing that you're seeing is that reproductive loss. And it happens early enough. Many times you don't see the fetus that becomes aborted. You're just seeing open cycling cows. You're seeing a lot of riding activity. Those types of things and a lot of open cows at pregnancy check time. So it's a difficult disease. You know, it depends on the situation, but you can have up to a 50% loss in your calf crop. And I mean, that's very significant. That's big dollars for really any cattle producer that you're talking about. It's a bad one. You definitely want to keep it out of your herd. And that's really the best way, is to prevent introducing it. We really don't have a good treatment. We really don't have any treatment for it that's effective. Or we don't have a preventative. We've got a vaccine that we can use. It's partially effective in cows. It does help to minimize the reproductive effects. You know, instead of, for example, don't quote me on this, but for 50% loss, instead of that, if you vaccinate your cows, maybe you'll have a 25% loss. So it's not going to address the disease completely. It's not a highly effective preventative, but it does help minimize those clinical signs if you're in a high-risk situation. So that being said, prevention, biosecurity, that is the best way to go after trick. And so that's where we're going to spend most of our time talking about some considerations, some methods that we can use to try to help minimize the risk of introducing trick into our herd. So if anybody has any questions, please pop them into the box. We can address them, and I'd be happy to have a discussion with you about anything that you might come up with. Wendy asks about testing for it. That's a good question. We test the bulls. That should be a part of your pre-breeding fertility exam. The way that your veterinarian is going to do that is to collect some preputial scrapings from your bull and send it into a diagnostic lab. It's pretty impractical to test and diagnose at the cow level. There are some tests for that purpose, but bulls are going to be really the best and easiest way to test for that disease. Once you have a positive in your bull, it's a safe assumption that it's in that entire breeding group. And so any bull that was in that breeding group should be assumed to be positive and culled from the herd. Most cows heal up from it. They resolve the infection within 3 to 5 months. Some cows can become long-term carriers, but typically they're going to have like a chronically infected uterus. And so you'll typically be able to tell if they're going to be chronic carriers of that disease. So getting rid of all the affected bulls in the breeding herd is the most practical way to try to get it under control. And then assuming your cows are going to clear that infection. So there are some methods that we should all employ to prevent trick from coming into the herd. Obviously, don't buy animals that are infected with trick. So buy young bulls, buy virgin bulls. Those bulls, if they haven't bred an animal, then there's no way that they could have the disease. So buy young virgin bulls from a reputable breeder. And then also you can test those bulls or have your breeder test those bulls prior to introducing them into your herd. Sue asks if those infected animals, if you can use them for meat. And yes, absolutely. There's no zoonotic risk to this disease. And the parts that are infected are not consumed anyway. So slaughtering, butchering those animals for meat is absolutely okay. Good question. Okay, so don't introduce infected animals. And remember, cows can be infected. They do get infected. And until they clear that infection, they can spread it to your herd or your bulls. So don't buy open cows. Don't buy cows that are bred less than 4 months. And that's gonna help prevent introducing that. One of the most common ways that trick is actually spread and spread from herd to herd is from your neighbors. And so if an infected bull of your neighbors gets into your cows in the pasture and breeds them, you can spread trick to your cows. If you intermingle, if you graze multiple producers all together, and one of the producers has trick in the herd or has introduced an infected animal, then it will likely spread to all of the different herds. So that's a big risk if you're co-grazing with other producers, on federal lands or things like that where there's not fences and all of these groups of cows are intermingling. Obviously there's only so much you can do to mitigate the risk in those situations, but it is important that you meet with those producers and you guys are all on the same page, meet with the veterinarians, come up with a plan that you guys can all agree upon to really minimize the risk of introducing trick into that situation, because nobody wants that, and it's a devastating thing. So that's pretty important. If you're intermingling with other herds, make sure you have a plan in place between you and the other producers and veterinarians to come up with a plan. Can it spread to horses or other livestock? No, it cannot. It's really a cattle-specific disease. Good question, Sue. Okay, we talked on the vaccine. You can use it. You can use it in your cows mostly to minimize the impact the disease has, but it by itself is not an effective preventative or management. Testing and culling is a very important part if you think you have it or if you do have it to get that under control. If I have a breeder bull, it would be possible for any cow coming in to breed my bull to have it, so cows can't be tested. Cows can be tested for antibodies to the disease, so it's possible to test cows. But a cow that's infected with trich will not be bred longer than 4 months. Okay, so if a cow gets infected with trich, she will lose her calf. So if you buy a bred cow, make sure she's 4 months bred or higher. You don't want to buy a cow that's open or short bred. Does that make sense? So that's the most practical way to make sure you're not introducing it on the cow side, is to check her pregnancy stats. Okay, and then just good production practices. You know, a defined breeding season is important. That way you can check your pregnancy status at preg check time, see what your percentage of bred cows is, so you can catch these problems early. So it's best if I don't allow anyone to breed to my bull. And I'm assuming, Wendy, that you mean like loaning your bull out to other producers. You know, that's okay. You can loan your bull out, lease your bull out. It's just important. Maybe you should test more frequently. You know, for example, test your bull for trich before you send your bull. Test your bull for trich before you introduce it back to your herd. So yes, that is something that's possible, but testing is very important in that situation. Would you test yearly? Yeah, I think I would. If you're in a high-risk area, especially, including that as part of the yearly fertility exam, that's a good idea, because honestly, you don't know for sure if a neighboring animal has gotten into your pasture, or even if your bull has gotten into your neighbor's pasture. I mean, it could happen where your bull jumps the fence, your neighbor sees it, puts it back into your pasture, and forgets to tell you. So yeah, I think that if you're in a high-risk situation, you should test your bull every year for trich. Is it possible if your cow does carry it a full term that she can pass it on to the baby? No, she can't pass trich to the baby. And infected cows will not carry a calf full term. They will lose it. They'll abort it. How long does it take for a positive test? Once you collect the sample, these PCR tests are very rapid turnaround, and so you should have a result within 2 to 3 days from your diagnostic lab. That really is dependent on your veterinarian and how quickly he or she gets it sent out, to what lab they send it to, but realistically, you can expect results within 2 to 3 days. Excellent questions. Keep them coming. Just gonna look through my notes, make sure I touched on everything I wanted to. Any more questions? And there are outbreaks of this disease every year. No, a fly does not carry this disease. The only way it is spread is through the act of breeding. So it lives on the reproductive organs of these bulls, and they serve as the carrier. And when that bull breeds that cow, that organism infects the cow. So breeding is the only way that it's spread. It's not spread just by contact through the nose, not spread through fomites, insects, anything of that sort. Good questions, good questions. And like I said, there's no treatment for it, unfortunately. It's a difficult disease. Okay, so we can shift gears, and if you guys come up with any more questions about Trick, put them in the comment box. I'll circle back to them, and if you come up with any afterwards, put them in the comments, and I'll go through Facebook comments and try to respond to all of your questions. Okay, so anaplasmosis is the next thing that we're going to talk about. Anaplasmosis it's another disease of pasture cattle, and it is a bacteria that infects red blood cells in these animals. Excuse me. What happens is this bacteria gets onto the surface of the blood cells, and then the animal's body, tries to get that infection under control, and the way it does that is by killing its own red blood cells. And so that animal becomes very anemic, and unfortunately it's unable to carry oxygen, and it can be a very severe, even fatal disease. It's a difficult disease. It's spread by blood. Ticks are a major way of spread. Biting flies, those are very common ways to spread it. But then anything that we do that can transfer blood. So anything that can become blood contaminated, such as a needle, if we're using a vaccine and we're vaccinating multiple animals without changing needles, that's very common. Dehorning instruments, tattooing instruments, castration tools, those are all common ways to spread this disease. So with your needles, ideally, if you're struggling with anaplasmosis, you're going to change your needle between every animal. Sometimes that's not practical. So at a minimum, every 10 animals, you need to change that needle. Any of your other instruments that have blood contamination, put them in a bucket of disinfectant between animals so that you can get that taken care of. Minimize the spread of that anaplasmosis. But insects are another really big transfer. Ticks especially, biting flies can do it. So insect control becomes important. It is difficult, but it does help minimize that spread. Anaplasmosis, it's what we consider a persistent infection. And so if an animal becomes infected at any age, then we should consider that animal to be persistently affected. And they serve then as a carrier for pretty much the rest of their life. So if blood gets transferred from that animal to a naive animal or one that has not been infected, then that's how the disease is spread. Treatment is, there's some methods for treatment out there to get rid of these persistently infected animals. They're really not realistic or practical. So I don't really recommend trying to pursue that. And then even trying to measure whether or not that was successful is difficult. So once an animal's infected, it's just safe to assume that it's persistently infected for the rest of its life. So that being said, they're not sick for the rest of their life. Once they get over the infection, then they really don't become sick from it again. They have immunity to it, and they just serve as a reservoir. So back to Sue's question earlier, Trick is not spread by flies, but anaplasmosis is. So just to draw that line of distinction there. It's really a disease of older cattle. And so if calves are infected, really less than a year of age, they don't become sick from it. Little to no sickness. 1 to 2 years of age, they might have a moderate to infection. But anything over 2 years of age, they can have a severe and even fatal infection. So Dustin asks, does Valley Vet sell the vaccine to our vet, or how do we get it? The one you mentioned. So back to the first question about the anaplasmosis vaccine. No, we can't get a hold of that. We can't sell that to your vet. Your vet has to buy it through that company, that University Products LLC. And their website is actually anaplasmosis.com. And Dustin, I'll come in after this live series and I'll comment to or respond or reply to your comment and put that website in there if you want to refer to it. But the only way that you can get it, since it is conditionally licensed, is through your veterinarian. Your veterinarian has to contact the company and buy the vaccine. and then you get it from him or her. Wendy Cruz asks, pass to calves from dam. And no, the dam doesn't pass the infection to the calves classically. There's a transfer of blood, sure, it could happen. But in the classic sense, no, it doesn't pass that way. Good question, Erica. Is there an area that sees more of this, Midwest versus South versus Eastern? Yeah, so this is a South to Midwestern disease classically. It's spreading every year, but anywhere that you have higher insect pressure is a more prevalent area for anaplasmosis. The farther north you go, the less prevalent it becomes, but like I said, it is spreading in its geographical regions every year. Good questions. When the animal becomes infected, depending on its age, but if you're seeing clinical signs, the animal turns very pale or yellow colored. They can be kind of uncoordinated in their movement. They run out of they become breathless very easily, panting, hard breathing. These animals classically become very aggressive. So please be careful if you're dealing with anaplasmosis, because they will, even an animal that historically has been very nice and easy and gentle, they will become aggressive. Just a big point to push home there. I've known people that have gotten hurt from these anaplasmosis cows because they lose their minds. Lagging behind the group, if they're slow behind the rest of the group, that's a classic sign. And then, unfortunately, sudden death. Sometimes you just find them dead because it can happen very quickly. So those are the clinical signs to look out for. If we catch it early enough, there is a treatment for it during these acute stages. Do you vaccinate yearly, and is it best to cull? Yes, it is a yearly vaccine. So initially it's a 2-dose series, 3 to 4 weeks apart, and then it's a yearly booster. The question on whether it's best to cull, that's kind of a tough one to answer. Theoretically, yes, you would cull these animals, but practically, no, I don't recommend culling. And the reason for that is because if your animals have become infected, it means it's in the area. And we all know these flies and ticks travel. And so the likelihood that it's going to become reintroduced into your herd is pretty high. And so if you're a seed stock producer and you want to try to test and cull, that would be an option. But for most commercial producers, no, I don't think that that's realistic. Really, the best way to address it is to get that level of immunity up, because once these animals have immunity to it, then they won't have the clinical disease. Good question, Wendy. Okay, and another point about this disease is it has a long incubation period. That can make it kind of difficult. Typically 3 to 8 weeks is its incubation period, but it can be all the way up to 3 months. What that means is these animals can become infected, and it can take up to 3 months for these clinical signs to show themselves. So it's tough to control in the classic contagious sense. Prevention is preventing the transfer of blood between these animals. So control the insects as best you can. It's difficult, but any efforts that you put forth to do that, fly sprays, rubs, fly tags, it's going to help. You can feed CTC in the mineral or in the feed, and that's where we'll start talking about the VFD. So we'll kind of circle back to that, but you can put that medication into the mineral for free choice consumption. And then the vaccine that we've talked about several times, you do have the option to do that. Okay, and then the treatment. If we catch this disease, there are some approved treatments, oxytetracycline, injectable, like LA200 or noromycin 300. There's several different brands out there. Those were just a couple examples. But really, any of those medications are approved for it. And then a recent approval has been enrofloxacin, which one of the brand names is Batril. So that's That's been a recent drug that's been approved for this purpose, and it seems to work pretty well. So that one is prescription status. You would need to talk to your veterinarian about that, and make sure you use the product that is labeled for it, because it's illegal to use Baytril or Interfloxacin off label. So tough disease. You know, if you're in an area that struggles with it, I think you'd know it can be pretty serious sometimes, and you can lose quite a high number of these adult animals when it gets introduced. So we'll kind of talk about VFDs now. What a VFD is, it stands for Veterinary Feed Directive. And this happened, I think, about 5 years ago. The FDA has changed their stance on feed grade antibiotics. They used to be over the counter, which means you could get them anywhere and use them really any way you want them to. But that's kind of changed. Feed grade antibiotics now require a VFD from your veterinarian to use it. Water antibiotics, water soluble antibiotics, are still prescription status. And there's a little bit of a distinction there. It's minutia, so we're really not going to go over it. But it's just different statuses that these drugs are under. So a VFD requires your veterinarian to fill out the paperwork, come up with a dose or a concentration in the feed or the mineral that you're giving, and then give it to you, or give it to the feed mill, or the store or whatever you're buying your mineral from, so that you can purchase this medicated mineral, medicated feed, or you can purchase the medication to mix yourself. So there are certain restrictions to it. There's some labels on CTC for use with anaplasmosis, and so your veterinarian is going to be the best source of information, but he or she would have to follow those labels for the use for anaplasmosis. Kind of a new thing, you know, in the grand scheme, but it's been around long enough that I think a lot of people are becoming familiar with VFDs. But if you guys have any questions about them, I'd be happy to address them here. I've got quite a bit of experience with them. Why is geriatric med marked up so much? I'm not sure, Sue. I mean, medications, I know they're expensive, but they take a lot of dollars to create and test and make sure they're safe. So I know it can seem frustrating, these VFDs. It just seems like one more avenue to charge or to get charged. But it really is pretty important to try to keep these antibiotics, you know, under control, keep the resistance levels down. Any questions on VFDs? Any questions on the Anaplas or trick? Well, thanks for joining today, guys. And again, if you have any questions, please put them in the comment box. I'll circle back through and I will answer those for you. Stay tuned here, because Melissa's going to come back on and give everybody a surprise, I guess. Thanks, guys.
All right. Thank you all for joining. Thank you, Dr. Tony, for all the information. If you have any questions, don't be shy and put those in the comments, and Dr. Tony can circle back around and answer those if you didn't get them answered. All right. One lucky viewer is going to get a Valley gift card, and that viewer is Dustin Bush. Woo-hoo. It's not as fun when I don't have my partner here to throw confetti on, but anyways, a couple more announcements. Don't forget about our Giddy Up shopping trip from Ariat. 2 winners. So get signed up for that. And then join us next Wednesday. We will be live again with Classic Equine. Thanks, everybody. See you next week.